Good morning again, everyone, and thank you for joining our Level Up Webinar Wednesday. I'm Dawn Lane, Program Manager of the Massey Learning Institute. International Men's Day was celebrated on November 19th this year. And one of the reasons this day is celebrated is to bring global awareness for many issues that men face. In celebration of this, our topic today is Real Talk, taking time out for men's health. So according to the Movember Foundation, Movember with the mustache, men's health is in crisis. Men are dying on average 4.5 years earlier than women, and for largely preventable reasons. A growing number of men, around 10.8 million globally, are facing life with a prostate cancer diagnosis. And globally, testicular cancer is the most common cancer among young men. But what about mental health issues? Well, across the world, one man dies by suicide every minute of every day. And males account for 69% of all suicides. Those are some sobering numbers. So let's ask ourselves these questions. Do women tend to live longer than men? What are some of the other common conditions affecting men's health? And the dreaded question, is a rectal exam really necessary? Our presenter today is certainly an expert in these areas and can answer all of these questions and more. Dr. Bandele Majeks was born in the UK and relocated to Barbados at the age of 3. He is of Nigerian and Barbadian descent. He earned his medical degree from the University of the West Indies in 2003 and completed an internship period at the Queen Elizabeth Hospital, the QEH, before migrating to the UK in 2005. He worked in both the surgical and emergency medicine fields before returning to Barbados to continue practicing in emergency medicine at the QEH. He rose to the ranks of specialist registrar, as well as obtaining a doctorate in emergency medicine. In 2016, Dr. Majeks co-founded Urgent Care Mobile, Barbados's first ambulatory medical clinic, with his partner, Dr. Makiba Brooks. Urgent Care Mobile played a pivotal role during the COVID years. He and his team took up the frontline challenge which the pandemic brought. They were heavily involved in education and testing of patients that were affected. They subsequently launched their own COVID unit, which is actively involved in testing of patients with symptoms and also those requiring testing for travel. I want to take this time to welcome Dr. Majeks, and I hope you enjoyed the session today. Dr. Majeks.
Thank you so much for that introduction, Dawn, and certainly introducing the topic today, which is men's health. I like to say it's a pleasure to be here with you, Massey family, and so welcome to those joining us from Barbados and throughout the region. To our Spanish speakers, bienvenido. So we're talking about men's health now, and I think we start with a very good question. Do women live longer than men? I think, historically, that is certainly the case, unfortunately. And I think if you ask the common man on the street or the common lay person on the street that's non-medical, whether or not this is true, the inkling is, yes, women do tend to live longer than men. There's often a joke when I give this presentation to large groups of men. a lot of them say that females are responsible for this fact. But I beg to differ, and we're going to go into the presentation and discuss why that is not so. In fact, I think it's quite the opposite, and I think women actually do contribute to those of us who are not dying earlier than expected. So from infancy to old age, women are simply healthier than men. Out of the 15 leading causes of death, men lead women in all of them, except Alzheimer's disease. And that is simply because men don't live long enough to develop this condition on average. The most recent data, as Don would have alluded to, shows that the gender gap in life expectancy is 5.3 years, which means that women generally live 5 years longer than men on average. Now, why is this? We all know the answer. From the time where toddlers bounce in on our mother's knee or our father's knee, we know that men like to engage in more risky behavior. So from this very young age, we know that they're the ones that are going to be climbing up the walls, jumping off high ledges, pulling at things that they're not supposed to. Men are simply more curious. And as we get older, and certainly we become adolescents, we engage in even riskier behavior, because that's when we start getting involved in things like motorcycles, bicycles, anything on two wheels, even four wheels. We're driving the cars at very high speeds, we're getting them modified. So we certainly engage in more riskier behavior throughout our life cycle. And interestingly, as we become older, less active physically, what do we tend to do? We tend to engage in more alcohol, and it becomes a common thing to sit at a bar somewhere, sit at home somewhere, gather with your friends, and engage in heavy alcohol use. Studies, however, suggest that estrogen helps protect women against heart disease by reducing the levels of harmful cholesterol which circulates in the body, whereas testosterone increases harmful cholesterol. That's interesting, because what we've seen is that up until the point of menopause, the incidence of heart disease and death related to heart disease, we see that men are more affected. But when we get to menopause stage, we find that starts to level off because of the lack of estrogen. So we're talking about testosterone and estrogen, and how estrogen tends to help women essentially survive the challenges of heart disease. So it's very protective. So what are some of the common conditions, as we mentioned, what are some of the common conditions that affects men? Heart disease, prostate disease we mentioned, mental health issues, erectile dysfunction, obviously that also impacts mental health issues. And there's something called andropause, which is a bit of a controversial topic, and we'll get into that a little bit further. Now, we spoke about lifestyle. Now, poor diet and exercise, they say, is one of the things that men tend to participate in. And we know that a nutrient-rich diet and regular exercise is crucial to maintaining optimal health. We all know this. Both have been proven to reduce the risk of chronic conditions such as heart disease, hypertension, and type 2 diabetes. Yet men are 50% less likely than women to maintain a healthy diet high in fruits and vegetables. Now, when I have this discussion with quite a few groups, here in Barbados, I've been challenged on occasion where men say that is not true. They're sitting around at work and they see what their female colleagues are eating, and they think they eat a lot healthier. I'm looking forward to hearing what the feeling is about this from some of our colleagues around the Caribbean, and certainly in Colombia. Let's talk about prostate disease. There are two common conditions we know which impact men. One is benign prostate hyperplasia, and we know that quite simply as an enlarged prostate. The other, prostate cancer. I've got a diagram here where we can see the male reproductive system essentially. And as you can see, the prostate here, which looks very much like a peach, the prostate sits at the base of the bladder. Now the prostate is responsible for helping us to produce semen, certainly. And as you can see, it sits right there at the base of the bladder, and it is also closely approximated to the anus and the rectum. That's going to be important as we discuss the examination of the prostate. So benign prostatic hyperplasia, or BPH. These are the symptoms that you can see that may be common for a loved one, especially as we, older men. So some men may be already familiar with this, or certainly, their loved ones may be familiar with some of these symptoms. So you get frequent urination at night. So you're not sleeping well because you're waking up quite a few times during the night to pass urine. There's an urgency to pass urine as well. So, as soon as you feel that you need to pass urine, you have to do it right away. For some men, they may have a difficult time actually starting the stream, and you would find some men actually go into the bathroom and they'll turn a tap on and listen to that sound, and that may help them to relax and pass urine. Some men get a weak stream of urine, and some men, unfortunately, quite embarrassingly as well, may develop dribbling at the end of urination. So you've passed urine, you think everything is finished, and then you get a few drops popping out. And then, so also, the inability to completely empty the bladder is one condition that affects us. And because we're not emptying the bladder completely, you may also get stagnation of urine, where urine is not being emptied completely, and you get urinary tract infections. So men presenting with frequent urinary tract infections may also be a sign that there is an enlarged prostate. So you can see here a diagram outlining the normal prostate and an enlarged prostate. So once again, you can see how that may impact us and produce those symptoms that we just mentioned, where it's compressing the urethra, which is the tract from the bladder going down into the penis, and that's where urine flows. And as you can see, there's some compression, as well as you will find generally irritation because of that enlarged prostate. So the prostate, we know, undergoes two growth cycles, one at puberty and the other at around 25 years. So between puberty and 25 years old, there's usually no growth. But once you become 25 years old, the prostate then continues to grow for the rest of the man's life. Prostate screening. Now, this is where it gets very interesting. So we know screening to be a mechanism where we test people in order to find if they've got cancer. Now, you can also screen for other health conditions, of course, like diabetes, hypertension, for example. The aim of screening in particular is to identify diseases simply before they become more of a significant problem. Now, prostate-specific antigen is a protein, or PSA, as you may be familiar with that name. PSA is a protein made by cells in the prostate gland. And notice it is cells in the prostate gland. So both normal cells and cancer cells produce PSA. PSA is mostly found in semen, but a small amount is also found in blood. The chance of having prostate cancer goes up significantly when your PSA level in the blood becomes elevated. Now, notice we're talking about PSA levels in the blood. We don't necessarily check for PSA levels in semen. And as we mentioned here, you normally expect to find a small amount of PSA in the blood. So when that starts to become elevated, we start to become suspicious that there may be cancer in this particular individual. Now, it does not mean, yes, you have prostate cancer, but it means that your risk certainly goes up. And that's why we suggest screening. Now, I have to say that as it relates to when you should be screening for prostate cancer, there's a little bit of a different approach, and I'm not sure exactly how, for example, it's approached in Colombia, but certainly in the Caribbean and here in Barbados, the approach may be a little bit different from what has been suggested, for example, in the USA, and certainly in other international territories. And there's a really good reason for that. Prostate cancer in the Caribbean population is actually significantly higher in Afro-Caribbean and Black men. It's significantly higher than it is throughout the rest of the world. It means we need to be a little bit more aggressive in our screening programs. Now, internationally, it's suggested certainly age 50 for men who are considered at average risk to start screening, and men who are expected to live at least 10 years. You would say that most men at age 50 are expected to live at least 10 years. So generally, internationally, it's recommended age 50. What I would say is that a lot of international guidelines, certainly most recently, have also suggested that there should be some discussion between doctor and patient when they decide on when screening should actually happen. So they've actually tried to put a lot of the initiative in the hands of men to get them more involved in deciding how their health should be managed. So notice I say that that's average risk, but the reason I say again that certainly in the Caribbean, that we're a bit more aggressive in terms of starting screening earlier is because we're all at high risk. So age 45 is suggested for men at high risk of developing breast cancer. And as you see here highlighted, this includes African Americans and men who have a first-degree relative which is a father or brother diagnosed with prostate cancer at an early age being younger than 65 years old. So notice it's not just African American men, but any man who also has a first-degree relative who's been diagnosed with prostate cancer at an early age. So here in Barbados, we certainly start testing at age 40, and these are for men who are even higher risk. And men who are even higher risk are considered to be men who have more than one first-degree relative who has had prostate cancer at an early age. That is very common here in Barbados and certainly throughout the Caribbean. What's an abnormal PSA? Now, this is actually the position on this particular value has changed in recent times. For men in their 40s and 50s, a PSA score greater than 2.5 is considered abnormal. Now, traditionally, we used a value of 0 to 4, but we recognize now that as men are a bit younger, we need to pay closer attention when the PSA level is greater than 2.5. For men in their 60s is when a PSA score greater than 4 is considered abnormal. Another good tool that we consider is an abnormal rise in the PSA. So a PSA score may be considered abnormal if it rises more than a certain amount, certainly within a single year. So we're not talking decimal figures per se, but if it jumps by 1 point or 2 points, then it becomes a bit concerning. So most men without prostate cancer, we said, will have a PSA level under 4. This is an interesting fact. Now, it again reminds us that we cannot look at absolute levels because about 15% of men with a PSA below 4 will have prostate cancer if they get a biopsy done. If a PSA is more than 10, your chance of having prostate cancer is greater than 50%. Now, I think this is important because what it says is that, and it goes back to what I was saying earlier, because you have an elevated PSA, it does not mean you have prostate cancer. However, it means that your risk has increased. And once that PSA is greater than 10, there is a 50% chance that you may have prostate cancer. So there are things that may cause an elevated PSA. An enlarged prostate, we mentioned, or BPH, advanced age, inflammation or infection of the prostate, ejaculation, cycling, so these are men who are sitting on saddles for a long period of time and riding long distances. They may have a baseline slightly elevated PSA level. And traditionally, we've mentioned before, examination of the prostate may cause a slight elevation of your PSA level. Now, most of these elevations are very slight, so they're not certainly going to carry a PSA level above 10. For the most part, prostatitis may do it, but the others typically won't cause your PSA level to be greater than 10. So I use this this particular caricature here to outline what, when we start talking about the prostate exam, what may be in the mind of some men who think about having to get this done. I single-handedly believe that the prostate exam is a big part of the reason why men are afraid to go to the doctor. And I'm hoping that what I have to say next will be comforting to some of us. Now, the digital rectal examination, which has traditionally been used as a screening tool for prostate cancer, there's actually lots of data which shows there's no increased benefit from this procedure. Cancers that are detected only by digital rectal examination are actually unlikely to have curative options. Many urological societies, and these are just the governing bodies essentially, which publish guidelines on how prostate cancer should be screened and managed, many of them do not recommend the digital rectal examination as a screening tool. What I would say is that certainly locally here in the Caribbean, up until very recent times, it's something that some of our urologists are still very keen to do. But based on, like I said, what I've said internationally, it's certainly not the key recommendation any longer. So let's talk a little bit about prostate cancer itself. It's the second most commonly occurring cancer in men and the fourth most commonly occurring cancer overall. These are some figures here published in 2018, where we see Guadeloupe having the highest rate of prostate cancer, followed by Martinique. What is showing here is that there's quite a bit of, in terms of the distribution in the Caribbean, the numbers are certainly very high. And Barbados is number 4, which is a bit disturbing. So we're looking at what is a normal prostate and a cancerous prostate. And as you can see on this particular diagram here, the prostate itself is not universally enlarged as it is with BPH. So you get one part of the prostate which is starting to enlarge, and as a result of that, this cancer has to become quite large in order for you to feel it, one, but also before it starts impacting the urethra, which means that the symptoms that you get with BPH, you don't typically get with prostate cancer. So this prostate cancer will be usually very far advanced before you start getting symptoms of not being able to pass urine, or the difficulties that come with passing urine. So just a little bit more on some of the symptoms that you may get because of where it is, certainly as it starts to invade the surrounding structures, this cancer can cause bleeding in the urine, so you may get what we call hematuria. But we know that other causes of hematuria or blood in the urine is a urinary tract infection, for example. It may also be seen sometimes with benign BPH. But one of the more sinister presentations that we see commonly is back pain. So certainly above us, beyond a certain age, at least 50, and you see someone presenting with what we call chronic back pain, persisting back pain, we need to have, and we don't know what the PSA level is, they've not been following up with PSA testing. We need to have a very low index of suspicion that this could be related to prostate cancer. And at that level, those men should be screened for prostate cancer, anyone with chronic back pain, and certainly consider doing x-rays just to make sure that there's no cancer going into the bones of the back. I think the most important thing to pick up from that is that the symptoms of prostate cancer, they only become very obvious when it's very advanced. So heart disease in men. This is another condition which is quite problematic. And in the US, it's the leading cause of death for both men and women. Men tend to develop it early in life, and we mention why, because of estrogen, and they're 50% more likely to die from it. Smoking, alcohol consumption, as well as stress, high blood pressure, and cholesterol are common causative factors associated with heart disease. Not to mention, of course, a family history. Some of the common heart diseases that we may be familiar with is coronary artery disease, cardiomyopathy, which is a diseased heart muscle, as well as heart failure. Today we're going to focus on coronary artery disease. We look in here at the coronary arteries. And the coronary arteries are very important for delivering blood to the heart muscle itself. So the heart, as we know, is responsible for pumping blood around the body, but the heart itself requires blood as well. So every time the heart pumps, and it pumps blood out into the body, it pumps blood also back into the heart and the structures of the heart, especially the muscles of the heart. Now, we're looking at what we consider normal coronary artery, where we can see the blue arrow is showing normal flow. And then there's a sort of constricted or narrowed coronary artery, where you see that flow, the arrow's getting a lot smaller because of the flow. And what we see building up there, the yellow is called plaque. And that is where cholesterol is building up in that area, producing what we call plaque. Well, that plaque, as we age, certainly is depositing through all of our vessels, but it becomes a big problem in the coronary arteries. So the more cholesterol, and what we call bad cholesterol, which is LDL cholesterol, then you would find that that plaque is depositing in those walls, causing narrowing. Now, the concern here is that your heart, like I mentioned, needs blood. And it depends on the activities that you engage in that influences exactly how much blood you need for the heart to pump. So as we get older, we tend to have very sedentary lifestyles. We sit in an office all day. Our heart isn't pumping as vigorously as it could. And so a narrow flow is not a problem. However, one day you get home and the children or the grandchildren says, "Hey dad, hey granddad, come and exercise, come and play with me." And all of a sudden you're doing something active which you're not accustomed to doing, and the heart requires more blood to flow through the coronary arteries. And all of a sudden there's not enough blood. And then you start to get this serious chest pain presentation. Now, here in the Caribbean, and we know that that can lead to heart attack, where it becomes completely blocked and you get death of the heart, of that particular part of the heart where the blood was going. Now, what I was saying is, that here in the Caribbean, we often talk about something called ear, and certainly here in Barbados, we talk about ear. And this is actually how many heart attacks may present, where there's a sudden discomfort in the chest, a little bit in the stomach or abdomen, as we call it. And for some people, that could be severe pain. For some people, that can be very vague pain. And we know classically that that pain may go up into the jaw or it may go down the left arm. But that's not always how it presents. And I really wanted to say that we know a lot of people who've suffered from ear and who died from ear, and that's because they've had a heart attack. So for encouraging you men, if you get any of these symptoms, discomfort in your chest of any kind, please do not think that is something we can sit down at home and drink a cup of hot tea and it will go away. Consider that this may actually be a heart attack. So what are the risk factors for coronary heart disease? Half of the men, and this goes back to what I've just said, half of the men who die suddenly of coronary artery disease have had no symptoms. Risk factors, family history. So often you would hear fathers had a heart attack. Sometimes a brother has had a heart attack, an uncle has had a heart attack. Advancing age, and once again, race. So but certain races are at high risk of coronary artery disease. Certainly in the Indian population, that's one. And once again, black men, black people are at increased risk. Other risk factors include diabetes, being overweight or obese, eating an unhealthy diet, physical inactivity, excessive alcohol use, high blood pressure or hypertension, we mentioned high cholesterol, and smoking. All tend to be factors that men, as you see, social factors that men tend to engage in more so than women. So I mentioned earlier male menopause or andropause. Andropause. So andros in Greek means human male, and pause in Greek is cessation. Now, I see that this is a bit controversial because it's not yet been completely proven to exist per se, and that's quite simply because as we get older, we simply experience some of these symptoms. Now, it's a syndrome which is associated with a decrease in sexual satisfaction or a decline in feeling of general well-being with low testosterone levels. So we're associating not feeling as well, not feeling as sexually satisfied or aroused, and it's linked to lower levels in testosterone. Testosterone levels decline with aging at a rate of 1% per year after age 40. The rate of decline of testosterone varies in different individuals. And once again, that's affected by chronic diseases such as obesity, illness, serious emotional stress, and medications. This decline can be decelerated or slowed down by management of health and lifestyle factors. Now, why I say this is controversial is because if you take two men and you measure their testosterone levels, they may be equal, but how the men feel generally may be completely different. So one man may be experiencing some of these symptoms, for example, which is decreased energy and desire for physical activity, lack of focus, motivation, whereas the other guy is not experiencing any of those symptoms and he's feeling just fine, and yet the testosterone levels are the same. But as you can see, there are quite some similarities between andropause and menopause in terms of the symptoms that men and women experience. Now, quite as we also know, depression can cause many of these symptoms, including erectile dysfunction, lack of focus and motivation, decreased energy. So, how do we know that this is due to testosterone and simply not due to excessive stress or depression, psychological factors? What I would say in terms of the relevance of andropause is if there is a man who's experiencing these symptoms, you may want to consider checking his testosterone level to see if it is indeed significantly low, and at which point you can consider him and his doctor ways of increasing his testosterone levels to see if that causes an improvement. Mimics of andropause, again, they said depression, chronic alcohol use, certain medications such as steroids, as well as having what we call low thyroid hormone or hypothyroidism. So these are things that you would consider if anyone is experiencing these types of symptoms. Now, what is the issue for us, for men usually with these types of symptoms? Quite simply, we don't like to talk about what's happening, which is exemplified here in this picture that we're seeing. This guy is clearly disturbed. There are lots of different reasons why this could be. And his wife, he's sort of turned his back and he's essentially shut down and not communicating what is happening. And this is something that traditionally has been the case. We've grown up to keep our thoughts and our problems to ourselves because we're strong. Erectile dysfunction. Every man occasionally has a problem achieving an erection, and such occurrences are considered normal. Erectile dysfunction occurs when a man is never able to achieve an erection, achieves an erection briefly but not long enough for intercourse, or achieves effective erection inconsistently. So one day he may be able to, another 3 or 4 days he cannot, or weeks. What causes it? Most often than not, it's actually psychological. However, heart disease, diabetes, high blood pressure, high cholesterol, obesity, neurological diseases, hormonal disorders such as thyroid conditions, smoking, alcoholism, and substance abuse are also some of the factors that tends to contribute. So as you can see, there's a long list of factors that may contribute to erectile dysfunction or ED. Now, the treatment is the blue pill, and so there are lots of options. There's Viagra, there's something called Levitra, there's Cialis. These drugs increase blood flow into the penis to allow for an erection. As a doctor, and certainly as a young doctor, what I often found is in doing, men may come to the doctor's office, most don't, but men may come to the doctor's office and they want to ask or discuss erectile dysfunction. They want to ask for some help, and they simply do not. They're afraid to do so. And I've seen situations, and I recall one time a patient essentially presented to me, and every time I thought the consultation was finished, we did a general health check, he would find a reason to sort of linger a bit, and I found him squirming in the chair a little bit. And he gradually, after some time, he started to leave the office. And as he got to the door, he said, "Doc, can I get a prescription? A little something to help." And I said, "Something to help?" And, I'm very young at this time. I didn't quite understand what was happening. And he made some gestures with his hands, and then I was finally able to understand what it was he was getting at. So then we went back, we sat down, we had a discussion, and we went from there. But what that did to me is it made me a lot more aware and cognizant of some of the issues, and obviously to pick up nonverbal cues, which has been good. Certainly in the household as a husband as well. You must be good at picking up nonverbal cues. But So in my consultations with men now, certainly when we're doing general health, I like to put it out there to discuss, to give them the opportunity to ask any questions around this and certainly to discuss it. So we know that men certainly commit suicide at a higher rate compared to women. And the stigma which surrounds, certainly here in the Caribbean, treatment of mental health issues continually impacts men more so than females. Men do die by suicide 3 times more often than women. Now, what we found is that the attempt to suicide, and I put attempt in quotation marks, for women is usually a cry for help. For men, they usually mean it and they want to die. And they would use the most gruesome, most definitive ways to end their lives, such as hanging, jumping off bridges, very definitive ways. Whereas women, they may take a few pills and they'll call you and tell you, I've just taken a few pills, which is obviously, a cry for help. So I think we've started to get a little bit better in encouraging men to talk, but at the same time, we still, there is an issue. There's a major issue for men discussing what's going on with them because we've been raised traditionally to be strong. Our fathers were strong, our grandfathers were strong. Any sign of weakness is not good. And I even in having this discussion with many groups, when I get to this part of the presentation I'm talking, 1 or 2 have said to me, men these days are getting soft. Those are the words, soft. And so, they tend to be impacted more. Obviously, rhetoric like that is not encouraging to get us to talk about some of the things that challenge men. And I'm looking forward to the discussion, I hope, to hear the opinion of some of the men in the group about that particular accusation, which is that men are getting softer. According to the American Foundation for Suicide, men died by suicide at a rate of 3.54% higher than women in 2017. The National Institute on Alcohol Abuse and Alcoholism puts the annual number of men dying due to alcohol-related causes at 62,000 compared to 26,000 in women. So we often try to drink our problems away. That's certainly one of the factors. I also think that alcohol use is very culturally motivated as well. It's just what we do. Depression and suicide are ranked as a leading cause of death among men, yet they're still far less likely to seek mental health treatment than women. We've had a spate of suicides here in Barbados recently. Once again, mostly men. And certainly, from those cases that I've learned about, each and every time, I'm told the relatives, their loved ones had no idea that their loved one was going through what they were going through. They're not even sure what happened or why they did it. So I think that says a lot. Every man has his secret sorrows, which the world knows not. And oftentimes we call a man cold when he is sad. I think it's important that, especially in things like this in the workplace, we have, we need to look around and sort of sometimes see what's happening and offer a listening ear, just to our male colleagues who are trying their best to stay strong. At this point, I would like to say thank you very much for allowing me to make this presentation, and I'm going to hand back over to Dawn and await your questions and discussions eagerly.
Well, thank you, Dr. Majeks. I was listening attentively, and I hope that our gentlemen on today And we're happy to say that we had a very good showing of the gents. I hope that they're ready with their questions because certainly you shared some current and important information with us. And I can't say enough or state enough on the importance you gave to early testing and screening. So Cherise, can you moderate our Q&A today?
Thank you, Dawn, and good morning to our listening audience. Our first question this morning, as a young man in my early 20s, how often should I go to the doctor?
So I think that's a good question. Really and truly, at least once a year is what I would say. And quite simply, I mean, I think most men have not gone to the doctor between 20 and 30, certainly because, if they're feeling fit, they're feeling well. But we pick up a lot of things during that period of time. And I think the most important reason for doing that, as we get smarter in healthcare, there's a new concept called anti-aging medicine, which is a big buzz. And starting to visit your doctor, getting comfortable, with that particular setup, seeing a doctor regularly, it allows you to plan as well. These are the things that I am not doing well. These are the things that I should be doing. And like I said, as we talk about anti-aging medicine, you can make preparations to help slow down your risk of morbidity and mortality as you do get older. So I encourage you strongly to at least have a yearly doctor's visit.
Okay, great. Thank you. Following on from that question,
if I'm looking at my health as a young man versus an older man, are there any specific tests that I should have when I go to my doctor or should request when I go to my doctor?
Okay. So as you get older, certainly as you get over, especially like it's mentioned in the Black population, as you get over 40, and they say life begins at 40. When you get to 40, you'll know exactly what they mean by that. But certainly we start to see a decline after the age of 40, quite simply because I mentioned testosterone levels tend to fall. Now, as a young man, which is typically considered up until 40, young, general things are what you want to check. So your blood pressure, your blood sugar, certainly your cholesterol levels, your weight, and those are the things that you generally want to test in addition to having a general examination, where you get your eyes checked, get your lungs checked, get your abdomen checked, check screening for, and I haven't gone into testicular cancer, for example, but also checking things like your testicles, looking for lumps, is also very important. These are the things that, for the most part, you should be doing as a young male generally. Now, depending on your family history, there may be some conditions which you may be more prone to as you be, certainly. And those things you may want to check for specifically. So for some men, for example, glaucoma is a thing that where there's elevated pressure in the eyes. That's something that you may want to be checking on. For some men, it's kidney diseases. So you may want to check for, have a kidney test. And as you get closer and closer to 40, that's a test that I certainly recommend. And then as you get older than 40, what are the sort of tests that you should be doing regularly? You want to do everything pretty much. So you want to check PSA levels, like I mentioned. You should get a baseline ECG, and that's something that you can start doing from anywhere around 30. As for people who are very athletic, we tend to start screening them a little bit earlier as it relates to checking for the heart and doing an ECG. But certainly after 40, you want to make sure you're checking the heart, doing an ECG, looking for the electrical patterns in the heart, plus full general examination from head to toe, which is once again checking for the testicles, etc., for any sign of testicular cancer. So cholesterol again, blood sugar, blood pressure, as well as, like I mentioned, prostate. Now, As you get older than that, then we start looking at things like the colon. So screening for colon cancer, usually anywhere after 50 is recommended unless there's a strong family history. And that may be done by a colonoscopy, where someone uses a camera to inspect the colon. More recently, we've started using a test called CT colonography, a CT colonoscopy, where it is not as invasive, and you're doing a scan of the colon as well as the rest of the abdomen using a CT scan. And that also has its application for people who are not at high risk of colon cancer. So those are the general things that I say that you should be looking to get done as you transition from a young male to slightly older.
Testosterone supplements would you recommend for use?
Right, so I like that question. I think it's a very good question. It's a bit controversial, once again. So it's something that, so they're very, over-the-counter medications that may have trace levels of testosterone, which I think are generally okay. But remember what I was saying is that your absolute testosterone level may not be an issue. There may be other things going on if you find that you're not having the drive and energy to do things as you used to. So I think that it's not a one-size-fits-all type scenario. Mention just generally jump on testosterone unless, over-the-counter, smaller amounts, I think is very reasonable. But if you're talking about higher levels of testosterone in order to try to boost your vitality, so to say, then that's something that you should sit down and discuss with your doctor because it has risk. So testosterone, we know, is linked to things, for example, such as aggression and mood changes, which can be a problem for men who may have mental health issues or maybe potentially at risk of mental health issues. It can also be linked to certain cancers as well, such as testicular cancer. So you need to make sure that is done in conjunction with your doctor so you can sort of weigh the risk of taking testosterone versus what benefits you expect to achieve.
So following on from that question, sometimes persons may use energy drinks to enhance their levels. What are your recommendations on those? Should energy drinks be utilized, monitor, or moderate the use of those types of energy drinks?
So energy drinks, if the typical energy drinks that are out there are usually mostly caffeine related. And we know that caffeine is something that we should be taking in moderation. So that doesn't necessarily, that's going to be very short and not sustained, certainly. And, it's only boosting to some level your energy levels, because of caffeine. So there's really not a lot of testosterone really meant to be in energy drinks. And that's always going to be short-lived, and once again should be moderated. The other thing that I would say is that the more energy drinks you drink, or the more consistently you drink energy drinks, the caffeine, it has less effect because your body becomes accustomed.
Thank you so much.
You're welcome.
All right, so our final question this morning is around erectile dysfunction.
But finally,
Erectile dysfunction, is this a permanent issue, or can it be reversed, or will I always have to use the blue pill?
So that's a great question. So it depends on the cause of the erectile dysfunction. So if it is due to a psychological reason, for some men that may be stress at work, or usually financial difficulties, worry about not being able to care for the family, emotional struggle. Fixing that particular problem should fix the problem with erectile dysfunction. If it is a more structural cause, or such as there's some health condition like diabetes, high blood pressure that is causing that, then it becomes a little bit more variable. So I would say that typically, as we get older, there's always a risk of erectile dysfunction occurring quite simply as we become older. Lower testosterone levels may also impact that. And we find that those aren't really That isn't usually a reversible cause. But sometimes if you do get the health condition corrected, for example, low thyroid levels, you get, start the thyroid hormone, you may be able to sort of correct it in that situation. Diabetes, a little bit more challenging. High blood pressure, a little bit more challenging. And also the other thing about high blood pressure is that there are some medications that we can use which can cause erectile dysfunction as well. What I would say is you want to do everything in your power to try to stop it from happening, which is, take good care of your health. Alcohol is another thing I may have mentioned, which can cause erectile dysfunction. So cut all the factors out that may influence or affect you in terms of erectile dysfunction. Try to reverse your health conditions if they've deteriorated, and then you have a good chance of sort of recovering some function. But traditionally, the blue pill is with you as long as you need it.
Okay, thank you so much for that insight. That concludes our Q&A segment, so I will now hand you back over to Dawn.
Thank you. Very thought-provoking. That last question, as you said, I was waiting for it. And I thank you, gentlemen, for being brave and for putting it out there. So I want to thank Cherise for moderating. And Dr. Majeks, I want to thank you sincerely for being here today and for bringing real men's talk to our audience. Of course, we have to have you back because, there's just so much more to discuss as we go along. To our audience, I want to thank you for your candid questions. Never being afraid to speak up on our MLI webinar websites, and for bringing those questions that I know that others may have wanted to ask. Thank you again for taking the time to listen to Dr. Majeks, who shared his wealth of knowledge with you. So, as we come to the end of our MLI webinar today, I want to thank everyone for joining us, and I want to remind you to look out for our end of year December webinar. That's on December 13th, and continue to look at our calendar, which is on our website. We have Introduction to Business Analytics. We have a special one called Jingle Bells, Managing Customer Expectations at Christmas. It's a customer service journey, leadership with a growth mindset, and of course our signature program, The Expectations of a Massey Leader. So, as indicated, remember, check out our website, www.themasseylearninginstitute.com, and until next time, remember to continue to level up. Bye for now.